Some of my patients are quite shocked when I tell them that they have gum disease. Their almost immediate response is, "How is that possible? I brush twice daily." So, in today's video, let's explore what could possibly be going wrong. Remember that the key to good oral health is effective brushing. So let's look at some of the common mistakes that people tend to make while toothbrushing. And the first one is using a hard bristle brush. Try and avoid these because these can do more damage than good to your teeth as well as your gums. So make sure you use a soft brush, and if you suffer from sensitive teeth, it's better to use an ultra soft brush. The next common mistake is not changing your brush regularly. Don't wait for your brush to look like the frayed brush in the picture. It is advisable to change your brush every 3 to 4 months or when you see fraying of the bristles. If you're having to change your brush too often, say every month, then it's possible that you're using too much of force while brushing your teeth or an improper brushing technique. The other mistake that people make is scrubbing their teeth vigorously. Now, this does not make the teeth any cleaner, but actually does more damage. It can lead to problems such as loss of enamel, gum recession, and sensitivity. I will demonstrate an effective brushing technique later on in this video. Avoid multitasking while brushing. It's best to stand in front of a mirror and brush your teeth. This ensures that you don't miss out any area while brushing. So for the back teeth, make sure you're cleaning 3 surfaces: the outside, the biting surface, and the inner surface. For the front teeth, it's the outer surface and the inner surface. Now try to be systematic while brushing. So start on one side and work your way to the other side. Avoid brushing randomly as you might miss a few areas. So now let's look at a brushing technique on a model, and this will make things a little more clear. There are a few brushing techniques, but this particular technique is quite useful, especially for those who are suffering from gum disease. So the mouth is divided into 4 quadrants: the top right, the top left, the bottom right, and the bottom left. So make sure you start on one quadrant and slowly make your way to the other quadrant. Try and be systematic so you don't miss any area. So angle your brush at 45 degrees to the gum line. Give it a gentle circular motion and then a downward stroke. Then move forward to the next tooth. Angle it at 45 degrees, a gentle circular motion, and then a downward stroke. Now for the back teeth, make sure you're cleaning the outside surface, the biting surface, as well as the inner surface. Now one area that quite a few people miss is behind the last tooth. So this area here. So if you're using a very large brush, it might not clean that area effectively. So it might be a good idea to use a smaller headed brush. So do the same thing on the other side as well. When you're cleaning the lower front teeth, you can angle your brush vertically and use the toe of the brush to clean this area. So give it a gentle rotation and then an upward stroke. A gentle rotation and then an upward stroke. This is quite effective to clean the lower front teeth area. This is another area where quite a few people miss out brushing, and I see a lot of buildup of plaque and calculus. So try this technique and I bet it will make a difference to your oral hygiene. Like we just saw, using a manual brush needs a bit of technique as well as practice to get it right. So if you're struggling with this, it's best to switch to an electric brush, which is quite effective. So while choosing an electric brush, choose one that rotates as well as oscillates. Personally, I prefer one that is rechargeable than the battery operated ones. Now the electric brush is quite simple and easy to use, but you again hold the brush at a 45-degree angle to the gum line. Let the brush do the cleaning for you. Try not to scrub. Most electric brushes come with a pressure indicator. So if you're using too much of pressure while brushing, there will be a light or there might be a special sound. And that will just train your muscles not to use too much of force while brushing. Gently guide the brush to each tooth surface that has to be cleaned and just allow the brush to do the job for you. Brush for 2 minutes. Most electric brushes also come with a timer, and if you're using it for the very first time, it can feel a bit strange and a bit odd, but you'll eventually get accustomed to it. Hope you enjoyed these tips, And if you have any more queries, you can visit www.dentalinfochunks.com. See you in the next video.